Hello friends, this is Dr. Rahul Chaudhari, spine surgeon working in Pune. My clinic, Spine Health Clinic, located at F.C.Road behind Hotel Vaishali. So we have this series of informational videos on various spine conditions, and today we'll discuss about lumbar disc prolapse, also called as the slip disc, and sciatica. So we'll cover in this video, we'll go over few discussions like what we mean by lumbar disc prolapse, then what are the complaints and what are the risk factors for developing this problem. Then we'll go over the diagnosis and the management of this particular condition. Now let's start what we mean by lumbar disc prolapse. Now lumbar spine. So as you can see, this is a whole spine model. So there is a area of the spine which is called as a cervical spine, it's a neck. Then there is a mid back called as a thoracic spine, and the low back it is called as a lumbar spine. So today we'll talk about the lumbar spine. So if you see, there are a series of vertebral bodies, and between these two vertebral bodies you can see the disc. This is a cushion like structure, and as you can see these yellow things which are coming out, so at each level there is one nerve which is coming out. So this disc is more like a shock absorber. It has an outer covering which is tough, and there is a soft gelatinous material inside which is called as a nucleus pulposus. Now what we mean by lumbar disc prolapse? So there are various medical terms by which we can describe this. Now disc degeneration. What we mean by disc degeneration is losing the hydration of the disc. So it is becoming more like a dry disc, and it is no more acting as a shock absorber. Such disc, if you get a repetitive loading on this disc, then you may get a bulging of the disc, and that bulging can cause the pressure on the nerves. Such disc, if there is a sudden pressure comes, then you may get a tear in the outer covering of the disc, and then such kind of disc material can pop out, which causes the pressure on the nerve. Now whenever you get a pressure on the nerve, you tend to get the pain in the leg, the pain which from the back comes down to your leg along the buttock, your thigh, calf, and the foot. This is also called as a sciatica. So now you know what we are talking about lumbar disc prolapse and the sciatica. So what are the risk factors and how common is this problem? So in this corona pandemic, I would tell you definitely that a lumbar disc problem is more like an endemic. Endemic means what? You can see so many patients with a disc related problem, especially the people who are having a computer job or a sitting job. So the risk factors behind this particular condition, most important is a prolonged sitting job, and is sitting for more than 10 hours, 12 hours, then daily long hours of commute, vitamin deficiencies, vitamin D3 and the B12 deficiency, lack of regular exercise, obesity, lack of sun exposure, addictions like smoking, alcohol. All these things definitely put you at risk. And moreover this, there is some family history. If your mother, father, brother, sister having a significant serious spine element, then that is also added risk factor for you. So now what are the presentation of what is the complaint? How do you know that you have a disc problem? The pain in the disc related problem usually episodic. It increases on activities. Whenever you are walking or you are bending forward, you are doing something, it may aggravate your pain. And whenever you lie down or take rest, it usually goes off. So it's a constant nagging frequently coming pain. It is different from the back muscle spasm, which is usually a single episode. You take medicine for 2-3 days, some rest, and you get better and you don't get that pain again. But in a disc related issues, you tend to again and again experience that back pain, especially on any bending activities. Now, if you have any nerve irritation in this particular problem, if the disc is touching your nerve, then it causes the tingling, numbness or heaviness or sometimes weakness in your legs. As we talk about the sciatica, so it is exactly if your nerve is getting irritated, you get that radiating pain along the leg. So with this background, I think how we can diagnose as a clinician, how we diagnose this problem. So initially we always get the x-rays of the spine. So what we see on the x-rays, usually we see the alignment, we see the space between the two vertebral bodies, if it is reduced or normal, is there any osteophyte like a bony outgrowth at the disc height, at the disc level. So all these things indicate that there could be a disc related issue. There is a gold standard investigation to diagnose this problem, and I would say that is an MRI of the spine. So always MRI is the one which we can, more than 99% we can definitely diagnose the disc problems. Disc hydration, is there any degeneration or any herniation, nerve pinching, the muscle, any muscle edema or swelling of the joints, all these things we come to know on the MRI, and we know exactly what is the disc situation. So if we want to diagnose the disc problem, MRI is must, and it will give us the complete picture of your spine. Now, as we are moving forward, so we will talk about the management. Anything, prevention is always better than cure. So how we can prevent this problem? If you don't have a disc problem, you're very lucky, and I think you should modify your, if you have these kind of risk factors, I think you should modify your risk factors. You should have regular exercise. Maybe you can do swimming, yoga or physiotherapy, back exercises, and adequate diet, regular sun exposure, keeping good hydration. This will definitely keep you away from the disc problem. Now we are moving toward the patients who are already having the disc prolapse or a slip disc. So what are the treatment options we have for these particular patients? First thing, more than 90% of the patients, they definitely get better with the medicines, regular physiotherapy and the rest. Usually we give some analgesics, muscle relaxants, rest for 1 week or 2 weeks, and with various physiotherapy techniques we can definitely control their pain, and then after that we help them to get into their routine and doing regular back exercises. Now there are 5 to 10% patients who may not respond to this particular treatment after a few weeks also. In those particular situations, depending on the MRI findings, if they have a pinching of the nerves, I prefer to do a spine injection. So this is an injection at the site of the nerve, or maybe if there is a swelling at the joint, we give an injection. So to reduce the inflammation, and it gives an instant pain relief within 24-48 hours to the patient, and slowly again we help them to get back them into their routine and doing regular back exercises. There are 2 to 3% patients who may not respond even to this particular treatment options, and they have particularly tingling or numbness or a severe radiating pain in the leg, not settling down with the injections or the medicines, they have developed any weakness in their legs, I think in such patients we may have to consider the surgical intervention. Now, what we mean by surgery? Definitely the disc surgery is, we call this as a discectomy, where we remove the fragment and we free the nerve. So this is the principle of the surgery. We call this as a discectomy. Now there are various ways by which you can do this discectomy. You can do a tubular discectomy where you reach that part and remove that fragment. You can do endoscopic or microscopic discectomy. So these are the techniques and by which you reach that disc level, remove the fragment and free the nerve. This is a very rewarding surgery. In last 2 decades, there are so much of advances has happened in this surgery. Within 24-48 hours, patient goes home. They can return to their job within 1 to 2 weeks. Only important thing they need to remember is they need to modify their risk factors and they need to do regular back exercise. And that will definitely cure their disc problem. So if you have any further doubts or if you want any more information, you can always reach us to our clinic on 80101 3003, or you can visit my website spinehealthpune.com for further information. Thank you.